At what ages do muscular dystrophy symptoms first appear? Imagine watching a child grow and suddenly noticing they're having trouble walking or climbing stairs. That could be an early sign of muscular dystrophy, a group of genetic conditions that cause muscle weakness. The age when symptoms first show up really depends on the specific type of muscular dystrophy. The most common form, Duchenne muscular dystrophy, usually begins showing signs in early childhood, often before the age of 5. Most children with Duchenne start to show muscle weakness around ages 3 to 6. Early signs include difficulty walking, frequent falls, trouble getting up from the floor, and large calf muscles due to fatty deposits. Kids might also be clumsy, have trouble climbing stairs, or walk on tiptoes. Because these signs appear so early, diagnosis often happens between ages 3 and 6. In contrast, Becker muscular dystrophy, which is related but milder and progresses more slowly, typically begins later. Symptoms often start during the teenage years or early adulthood, sometimes even in the mid-20s or beyond. Children with Becker might experience muscle weakness later in life, and the progression tends to be slower, allowing many to maintain mobility longer. Other types of muscular dystrophy can have different ages of onset. For example, Facioscapulohumeral muscular dystrophy usually develops during teenage years or by age 20, but it can sometimes start as early as infancy or as late as the 50s. Limb-girdle muscular dystrophy varies widely, with some subtypes beginning in childhood and others not until adulthood. Myotonic dystrophy often begins between ages 10 and 30 but can sometimes start at birth or even later in life, up to age 70. Because there are over 30 types of muscular dystrophy, the age when symptoms first appear can vary a lot. Early signs generally involve muscle weakness and difficulty reaching motor milestones or doing daily activities. If you notice these signs in a child or even in yourself, it's important to see a healthcare professional. A specialist experienced in muscular dystrophies can perform tests to diagnose the specific type and recommend appropriate management. Remember, early diagnosis can help with planning treatment and support to improve quality of life. Always consult a healthcare provider for personalized advice, as the timing and progression can differ from person to person.